Hi everyone, and welcome to my channel. Today I'm going to be talking about a procedure I had done, which is BBL, Vaser Lipo, and Cell Saver. I'm going to go into a lot of details because I want to share this video, first to share my journey, and second of all to share things that I was not expecting after I had my surgery. So thank you and welcome. What is a BBL? A lot of us know what a BBL is, and for those of you who do not know, it is where they remove fat and they transfer it into your buttocks area. A Vaser lipo is a technique that they're using, which is the cannula has ultrasound and heat to suck out the fat out of the person. A 360 is when you have the lipo done on the front, side, and the back of your torso. Now, why did I have the Vaser? Vaser is not for everyone. Every patient is an individual consultation, so depending on the patient is what the surgeon recommends. I had a lot of bulk fat on my back, so that's why I qualified for the Vaser. Vaser gives an after tightening skin effect to avoid that extra loose skin. There are some people though that require a tummy tuck, but like I mentioned, everyone is different and it depends on your goals and on the consultation that you have with your surgeon. I wanted to have this done for a period over 2 years, and the reason I didn't do it any sooner was because I was looking for a surgeon or surgeons or a place where they do the BBL, but the skinny BBL, the one that goes proportioned with your body. Today, right now, I am 4 weeks post-op, but there's some things that happened after my surgery that I was really not expecting, and I want to share that journey with you along with the whole entire procedure. Why did I pick this place aside from it doing the natural looking skinny BBL? Is because this place from day one, they have been using ultrasound in order to determine the safe depth to use when they go in and do the fat transfer on the buttocks area. Let me repeat that one more time. This place is the first place where they actually practice using the ultrasound to transfer the fat into the buttocks area and avoid that danger zone that is known for the BBL procedure. Before I take this any further, I also want to mention I am not a medical professional. I am simply sharing with you guys this journey that I had this procedure done. My main focus was to remove the bulk of the fat on my back, which was bothering me for many years. But again, I held back because I figured if I'm going to be on the operating table, I might as well have a 360 lipo and a fat transfer that goes adapted to my body. There's a few things that one must keep in mind, which I already knew. But one thing is being told about it, and the other thing is actually going through it. I knew that the recovery was going to be 4 to 6 weeks. I knew that I was going to lay on my stomach for 6 weeks. But I knew that me sleeping on my stomach was going to be very difficult for me. And it still is, even after 4 weeks. But that is part of the healing process. You do not want to sit on your buttocks for after the 6 weeks time frame. Now, the first 2 weeks, I will tell you that my first 5 days were absolutely brutal. I was in agonizing pain. The Vaser lipo, though, decreases inflammation, decreases the bruising, and the swelling it goes down quicker. The swelling for this procedure takes 3 to 6 months to see the final results. So the main swelling will go down in a few weeks, but the ultimate swelling goes down 3 to 6 months, and after 6 months is when I'll know what my body will look like. What I was not expecting was that after, even though I had the drain, I was leaking a lot of liquid in my other insertions, and it got very messy on the floor, on the bathroom, and on the bed. You definitely want to consider having old sheets around, using extra towels, and having a shower curtain to put under your sheets so that you don't pass through the mattress. Even though I had the waterproof protector, still I don't want to be dirtying up so many things and then worrying about having to wash it afterwards. Another thing is that if I would have known, I would have had extra ABD pads. These are pads that are put in your incisions so that it can absorb that excess leakage. And this goes underneath the garment, okay? So that it can absorb all that extra secretion that comes out of the incisions, aside from the drainage that I had attached with me. It was very painful, so it was hard to sleep long hours. Now, that was in a way it was an advantage, because another thing I did not know was that even though you do need to rest, you must get up every hour to walk for 10 minutes around the house. We're not talking about walking around the block. No, we're talking about just walking to help with the circulation, to help avoid the blood clots. Even though I had compression socks on, I had to wake up or get up every hour and walk for 10 minutes. The other thing is drink a lot of water, 1 to 2 gallons of liquid. It includes water, Pedialyte, Gatorade, coconut water, tea, and it's recommended to have fresh pineapple, because pineapple helps a lot with the swelling, and it's something that's very natural. So those are the things that I was really not expecting. I was also not expecting for the following day to get my massage. Yes, the massage the day after was extremely painful, but as the days go by, it does get better. I also did not know that I was going to switch my garment within a week to phase 2. So yes, after I switched to phase 2, what happens is there's a lot of compression. Why is there a lot of compression? Because I did not know that foams went inside the garment, okay? 3 of these things go around my torso, and then a triangular one goes on my back. And I'm going to show you real quick. Here I have my foams on, and I have my garment on still after 4 weeks post-op. So this will be on like this for 6 weeks. Because of the foams, I am not able to put the garment on myself. I need someone to help me. So if this is something that you're considering having done, especially the first 2 weeks, you're going to be in so much pain, and putting the garment on is a little bit painful and stressful, because someone's helping you put it on, but they're not really. The goal is to try to put it on, but without you feeling that pain when they're trying to press things. Any little touch is extremely sensitive. So yes, I didn't know about the foams. Why the foams? Well, I learned this during my massages, and I learned this as I went along. The foams are for there to be extremely extra compression. That will give you that beautiful bottle shaped look. The extra compression is not to allow what you're secreting, or what the fluid that is being removed from your body during the massages or during regular body movement or with the drain, is that they don't want you to have any room for that liquid to go elsewhere. And if too much liquid goes around your torso, then you will be facing what some people have experienced, which is called fibrosis. So in order to avoid fibrosis, I had the pads on, and I had massages done after my surgery. Because there's so much compression, my legs swelled up immensely. So what I did was I removed the compression socks 5 days after. I had to put them back on, and I had them on consecutively about 2.5 weeks. until the swelling of my legs went down. I was very concerned because I've never seen my legs swell like that, but it's a natural defense mechanism that our body has when there's so much compression on the waistline. There was a time one night that I could not sleep because the compression was so severe that when I would inhale, I would feel pain on my back, and I had to remove a couple of buttons here on the top of my garment so that I was able to breathe, because my torso is a little short and my bird cage on top expands. So every time I would try to breathe in and out, it was a bit bothersome in the beginning, but you know, you do grow out of your garment as you start to deflate when all that swelling goes down. So yeah, those are little things here and there that I experienced that I was not expecting. Even though with the Vaser lipo, it's less painful, I was under agony pain for 5 days. After the 5 days, then it all started going down. So that pretty much sums it up. I'm going to try to remember some other little things here and there. The first 2 weeks, you're not allowed to sit, not even on a special pillow or the BBL pillow. They don't want you to have any type of movement back there that's going to altercate your results. So that's why there's no sitting, not even with a special pillow, for 2 weeks. That's another thing I did not know. And to be honest with you, sitting on that pillow was rather uncomfortable. And driving, forget about it. I'm going to show you guys the pillow in a second. And I've been mainly either standing up or laying flat on my stomach. The disadvantage of laying on the stomach, besides it being so uncomfortable, is that you have all the blood flow and all the pressure going to your face. So every morning I would wake up with my face extremely swollen. And I still do, but it's not as bad as in the beginning. Let me show you guys what a BBL pillow is. It's this thing right here. And your thighs basically lay here, right? And let's say this is my thigh. So basically you're gonna lay your thigh here, and my elbow, let's say, is my butt. That's gonna be in the air. And then the rest of my arm, let's say it goes against a back. So you probably put another pillow back there to get support. But the whole point is, again, let's say my elbow is my butt, is for your buttocks not to touch anything and for it to be in the air. So this is what they call the BBL pillow. I just Googled BBL pillow, and they sell different packages for different things. And I got that one so that I can try to sit down, which I have not really been able to, but I have had to use it to drive. I will not drive without that, and I try not to drive at all. The other thing that I've had really difficulty, and something that is not recommended, is to bend down. And of course, I would drop a ton of stuff on the floor without being able to pick it up. But it's a good thing I had company and that they were able to help me with that. But also, you do not want to make too much or have too much movement back there to be bending up and bending down. You know, you want to avoid as much movement back there as possible. Now I'm up to 4 weeks, so I can bend now. And it's amazing how our body works, because we need to listen to our bodies. Even if I wanted to bend down, I wasn't able to because my legs were so swollen, my body was so swollen, and with the garment and with the sponges and all that, I really can't move to bend down. So in a way, it's beneficial because my body's telling me, no, you really can't bend. Now I could bend, but I cannot bend like on my knees to dig and grab something out. I could bend probably a little bit below knee length. And yes, every day I'm getting better. Every day there's more swelling going down. And that's pretty much it. After the 6 weeks, is when I could start laying on my side, I could start sitting normal, I can start laying on my back. And this is something that more than likely there's going to be a little bit discomfort, a little bit of pressure, but that is perfectly normal because there's a new body, and it's, adapting, for the movements that we used to do, but they feel a little different. What I'm going to do is definitely get a donut pillow. Those are the ones that you blow up, so that if there's any hard surface in the beginning of after the 6 weeks, I could sit on that, so I don't sit on hard surfaces right away. And after the 6 weeks is when I can exercise. I can start a diet, but not something crazy massive, because remember, you want those fat cells to remain in the buttocks area. And if I do a crazy diet, then all those fat cells are going to disappear really fast. Another thing to note is that all fat transfers, you lose about 32% of the fat that was inserted. So whatever it is that's seen there in the beginning will definitely deflate with over time. We're talking about swelling, and we're talking about 32% of that fat just going away. And the other thing is that I can start to exercise, but I was told do not do cardio yet. Do like some weightlifting, strength training, but no cardio, because again, you don't want to be burning fat when you're trying to save fat from your buttocks area. After the 6 weeks, when I complete the 3 months, then that's a different scenario. And when I get there, I'll inform you all. But right now, my goal is that I'm 4 weeks, heading to my 5th week, and I'm so close to my 6th week that I really can't wait to be able to sit down. But I've seen some people on social media. It's very uncomfortable to try to watch TV laying down and looking at things on my side, but I've been mainly looking at stuff on my phone, and I'm so used to reading sitting down that it's kind of hard to read laying sideways. But I'm just binge watching movies. There's not much I can do, and there isn't much you should do. They do require for you to restrain from trying to mop or trying to clean. Even though I want to, there's plenty of time for that. There's plenty of time to do the things that I used to do. The main thing is healing day by day, be good to myself in the meantime, and be patient. Be very patient, because all those things I will end up doing sooner or later. And I don't want to compromise something that's been paid for, and something that that I am in the process of healing, and not interrupt what it's supposed to do. Something that came to my mind is the massages. When I had my surgery in mind and I had a price, the price of your garment, the price of other things that you may need, and the price of the massages are completely separate. That is not included in your surgery. So I would say I'm located in Miami. The massages here are averaging per massage $100 to $130 per massage. I did 10 massages, so calculate that. The doctor recommended 20 massages, and I thought it was maybe a bit too much, but I did 15, so that I'm not doing 20 and I'm not doing less than 10. I did had some sarcoma, and that's when my insertion closed up and there was liquid, and I did have to go to the clinic for them to remove some liquid that had accumulated. So yes, that did happen to me. I healed pretty fast. So the massage therapist tries to drain that out during the massages, but after the drain came off, my incision closed up really fast. So that's something else that is very possible after having your drain removed. I hope this was very informative, and if you guys have any questions, go ahead and ask me in the comments. Ta-ta for now, and I will see you guys soon.